Treatment has changed and expanded a great deal since I was first diagnosed. When I was first diagnosed, the only drug that was available was lithium and anti-psychotic medications like Thorazine, but lithium was the first drug that had been found to be really helpful in preventing future episodes, future attacks of mania and depression. In subsequent years, there's been a lot of research done, and it gets an absolutely staggering amount of research in terms of understanding the brain and the genetics and many of the psychological aspects of bipolar illness, which is quite wonderful. And along the way, different classes of drugs have been used, drugs that have been used with seizure disorders, the anticonvulsant medications, antidepressant medications, which can be problematic in some patients with bipolar illness, but very helpful in others. So there have been many different kinds of medications developed, but also there's been a lot of research on the effectiveness of combining psychotherapy, particularly early on in the illness when it's most difficult for people to accept the idea that they have bipolar illness and that they will need to be treated for it. And psychotherapy can be particularly effective in that group of people. It's often asked, particularly when people are young or early in their illness, can I be in psychotherapy alone? Will that work alone if I have bipolar illness? And the answer is rarely, very rarely. That mostly medication is the central part of treating bipolar illness, particularly the more severe forms of bipolar illness. So it's critical to get that across, that it is a medical condition that requires a medical intervention. But can psychotherapy be hugely effective and helpful? Absolutely, because the psychological consequences of having such a, potentially impairing illness, but also very painful illness and difficult illness with which to cope. And it affects so many aspects of who you are and how you are, your energy, your mood, the whole way you approach life, your relationships, your work, your ability to concentrate, your ability to think. So it's very important to get it diagnosed correctly and get it diagnosed early. And to, reconcile oneself to the idea that, you're probably going to be on medication indefinitely, but worse things could happen.